Welcome to the Athlete's First Performance Podcast, where two performance-minded physical therapists break down the evidence to improve overall health, movement, and performance for athletes and active individuals. Okay, welcome to episode 17 of the Athlete's First Performance Podcast. We've got two special guests today, Brandon Surber and Madi Franek. So we'll give a brief intro of who these two guests are, and then we'll dive into the topic. So Madi, do you want to start with a little bit of your background and where you're at now?
Absolutely, James. First off, just thanks for having us on again. You know, the conversation the first time around was absolutely enjoyable. So hopefully we can get some good kind of key clinical takeaways from today's conversation as well. But yeah, for everyone who didn't listen for part one, my name is Madi Franek. I've been a practicing therapist for going over 4 years now. So I graduated from Duke in 2018, and I've been practicing in the outpatient kind of orthopedic and sports medicine setting since then. I'm currently practicing in Chapel Hill, North Carolina, and my specific interests are, return to sport considerations, specifically after ACL reconstruction, and specifically trying to take complex systems that are, say, at the elite level and trying to apply them within the context for the everyday outpatient clinician.
Awesome. Thanks. And Brandon, to you.
Yeah, so thanks for having me on as well, James. And Madi, thanks for extending the invitation to do this. I know that first episode you guys did, I've listened to it 3 or 4 times and still don't feel like I got everything. Like I've got a ton of notes on it. So, but yeah, my name is Brandon. I've been a physical therapist for a little over a year now. I graduated from UNC last year. I currently work at Duke Sports Medicine, and I'm an athletic trainer as well. So I kind of split my time in my current position, depending on what season we're in. So when I'm in the clinic, a lot of post-operative shoulders, knees, so ACL reconstructions and PFL reconstructions, just all those things. And then on the athletic training side, cover one of the local high schools in the Durham area too, and help out with some of the things they need there. From a clinical standpoint, one of the big things I've always been interested in is just post-operative ACL reconstruction, kind of from beginning to end, and trying to refine the process of that, which has been really interesting as a new grad, seeing kind of where I thought I was to where I would be in this first year. So, but also interested in just performance in general. And then over the past year or two, gotten really interested in kind of like physical activity guidelines and implementation of that too. So known Madi for a little over a year, I guess now, because he was one of our capstone advisors. So he kind of brought me into this world with the deceleration and on-field rehab stuff as well. So have nowhere near the repertoire of information he's got, but trying to get there slowly. So
great. No, I'm definitely looking forward to hearing Madi's thoughts. So the overarching goal of this podcast is talk about horizontal deceleration in the framework of ACL, return to play, return to performance, as well as just overall profile testing for ACL patients. So Madi, do you want to just start us off with your framework and where we want to get into with this podcast?
Absolutely. So, I think a good foundational place to start with in the context of horizontal decel is, it's a very demanding task. There was a really good, I don't know if it ever got published out of the isokinetic group in Italy, but they looked at, I think this was within a healthy cohort at the time, but they were looking at kind of quote unquote injury risk factors for, I think it was ACL injury. And they looked at like a sidestep cutting task versus just a linear kind of horizontal deceleration task. And they found that individuals within the context of this particular study demonstrated more, I think, prevalent risk factors within the context of just a linear decel relative to the sidestep cutting task. And I think what that kind of study really speaks to is this idea that oftentimes we think linear decel is, something that it's not, maybe too demanding. I think a lot of our attention goes to the 90-degree cut, the 135, 180, just because like the 505 context and things like that. But I think we need to maybe do a better job at really appreciating the demand that a true linear task kind of presents. We know specifically after ACL reconstruction, we've heard it from everybody, quads are king and queen. And I really like the linear decel task because it's going to keep you in that sagittal plane and really demand a high eccentric load coming from the quad. Oftentimes within some other tasks, specifically we're looking at like maybe a 45-degree sidestep cut where, velocity maintenance is key, right? There may not be as much of a demand on the quad within that particular task just because of the demands of it, right? 90 is going to be relatively high, but it's also going to have a really high kind of multiplanar hip component to it. And then 180 is going to, have a high, knee sagittal component to it as well with that multiplanar load. But, I think we tend to rush the linear decel. And again, I see a lot of things within the context of, social media where it's, multiplanar, even going back to like foundational plyometrics and things like that. There seems to be this ever increasing just interest in increasing the complexity of things. And I think we maybe tend to overlook the prerequisites that help us kind of get there really good. So one thing for me kind of clinically that I spend a lot of time on, and I'll credit Rich Clark from the UK out of this. He's been really kind of foundational in my thought process regarding all of this. But, just because we have a task like linear decel, right, doesn't mean that we can't continue to progress it throughout the entirety of the rehab process as we're implementing our change of direction or multi-directional work as well, right? And so, there's some really good stuff from Rod, or was it Rod Whiteley's group at Aspetar, where they looked at coming off of a hamstring strain. And they looked at the ability to get back, within this context, it was the ability to get back to, pre-injury max velocity work. And they found after the context of the hamstring strain that individuals were not necessarily getting there. And this really brought up a really interesting thought within the context of ACL reconstruction in the sense of, oftentimes we're subjectively asking people like, hey, do you feel like you're back to sport? Do you feel like you're at your same level? Enda King's done some really good work that subjective and objective metrics they tell two separate stories, right? They're good to have both of them. And I'm definitely advocating that you take your ACL RSI and you get the subjective alongside the objective. But I think it does bring up this interesting idea that just because somebody says they're back to what they're doing, are they actually back to their prerequisite? In this case, maybe entry velocity speed going into a linear decel task. And my hypothesis would be that I would think that those things would be down. I'm not sure if those entry velocities or entry speeds would be as high as they would say pre-injury. And so, that's just kind of an interesting thing to keep in mind when we're looking at a specific task. But I think that really speaks to the importance of throughout the entirety of the on-field rehabilitation process, really ensuring that we are trying to get up to, if we have pre-injury data, pre-injury norm regarding entry velocity, or if we have, normative data regarding a healthy population, kind of seeing what those entry points are. I think that's a big limitation within a lot of studies, as well as oftentimes when you look at like a change of direction task or a cut, for example, it's looking at maybe like a 10 meter entry or a 5 meter entry. I think it really limits the kind of approach speed going into it, which is going to limit the overall kind of unique sensor component and just the demand of the system. And so that's why I like a lot of the stuff that kind of Damian Harper is doing, because when you look at his ADA test, they're going 20 meters into a cut or into kind of in a stop. I think that really does a good job at ensuring that we're getting higher velocities and maybe a little bit more representative of sport. So in terms of, I obviously went on a side tangent here, but in terms of the importance of decel, I think it's just all to say that, just because you have your 5 meter, your 10 meter task, don't stop progressing that task within the context of the rehabilitation process, right? Continue to do that, continue to progress it. And when you're doing that, then just supplement, your multi-directional speed work kind of at the same time, if that makes sense.
Oh, those are definitely great points. Stepping back a little bit, Brandon, do you have any thoughts on when people are ready to begin that horizontal deceleration test and that on-field rehab?
Yeah, so it's really interesting of kind of looking at some of the different models. Like I know Maddie talked about Matt Taverner's work and then some of the work from Buck Thorpe in the last episode you guys did together too. And so it kind of depends on, I think a lot of times, like which component of it you're talking about. So if it's maybe some of the lower level, like just re-entry, getting accustomed to like high speed running exposure or something like that, where that may come along a little earlier than some of the like, where you're doing high demand deceleration tasks or adding in a lot of those things. So I think that's where those models kind of going from more of a linear focus part of that progression into something where you're getting more reactive and you're getting higher speeds at the end and you're kind of demanding more too. And I think a lot of it is as you're thinking about like those underlining like capacities, which I know Maddie's going to touch on some more of that too, of where are those things at? And so just your kind of your basic stuff. Like I know Maddie's talked about this too, of just like getting good at the basics. Like I've heard Mike Raymond say that before, or others like Chuck Bigpen. I've heard him say like block and tackle as an example. Like, you got to do the basics. So kind of getting those underlining things like peak torque, knee extension, or so that's kind of where, and this is just from, having limited experience the past year of doing some of this. That's one of those big things where I'm trying to start testing it earlier to see how I feel comfortable. And that's, returning to running, all those things too. But there are certainly things where if I can see certain aspects of those tests are based on, if you're at an 80% LSI, or kind of shifting more towards like peak torque to body weight of stuff I've been looking at too. But all that to say is some of those things will come in a lot earlier, but some of this, really high quality deceleration work we're trying to work on, we're usually going to want them to be putting out a lot of peak torque on that side and really demonstrating kind of, good mechanics as much as they can. And that's where too, like, I know I've talked to Maddie about, can you boil some of these things down to like one task as an example, or that may even be too simple, but as opposed to trying to look at, 50 different things, which is one, not realistic a lot of times in like an insurance-based model, or two, if you have limited time. So it's, can you figure out what maybe the most important underlying quality is, and then you can almost build that in as a test while you're doing some of the progressions too. So yeah, it's kind of a broad answer, but just like, kind of depends on where some of that stuff lands.
Perfect. So Maddie, Brandon was talking about maybe like one test to determine if an athlete is ready for horizontal deceleration. What are your thoughts on using different gym-based measures as a proxy to determine the force capacity and the ability to perform horizontal deceleration adequately?
Yeah, so I think this kind of goes back to a lot of what other individuals like, Eric Maris say, when, knee extensor output is probably the place to start. And, kind of my thought process is, if you don't have the isolated, knee extensor component, then to me, there's really no sense in getting, far-fetched with a lot of the other measurements. You're looking at like global strength, peak strength measurements, global peak power measurements, or whatever you're looking at from that perspective, looking at reactive strength, just because when you start kind of getting into a lot of those other metrics, there's going to be a very high, knee extensor component that's, associated with it. Right. And so my thought process is, if you can't do the isolated task well, then, there's really no sense in measuring the other components. And, oftentimes I think, we look at something like, a counter movement jump, or, a drop jump task. And, I think having a better appreciation for how much demand, say, goes through the knee component is really important to determine not only the implementation of that as an exercise, but also where does that stand in relation to your other measures. So for example, if you look at that kind of counter movement jump, kind of reactive strength article that was put out by Kosabowski in the last year or so, I think it was, there's a couple of good tables in there that kind of identify within kind of a healthy control group how much load goes through the knee component. So within say a vertical jump, they found within kind of, I'm assuming it's an external knee flexion moment, looking at somewhere within upwards of maybe 2.1 Newton meters per kilogram. If you go back and you look at something like a single leg drop jump, right, in terms of the external knee flexion moment as well, and you're talking in upwards of 3.2 Newton meters per kilogram, right? So these are very high demanding tasks. I think oftentimes we may implement them too early on within the rehabilitation process. And I think it goes back to a very foundational thing. Just because someone can do a task, right, doesn't mean they're necessarily doing the task well, right? And so for me, I think Enda King has a really good framework, within this thought process on Swarsmith, looking at maybe how we kind of go through these different measurements. And so the first place that I'll start is looking at an isolated knee extensor component. I think it's kind of up for debate in terms of looking at the specific metrics that you might want to aim for. And I think obviously it's going to be dependent upon what you have available to you from a testing component, right? So I think a great place to start is looking at an isometric test. But I think if we look at, some very kind of foundational strength and conditioning principles of, applied adaptations, right? Or kind of the SAID principle. I think if you have a isokinetic dynamometer, it may be of value looking at maybe an eccentric component to that, just because there may be an ability to exert a higher force output, maybe relative to the task demands, right? I've had, some discussions with people that, say there may be a little bit less reliability within that test, say relative to an isometric test. But I think if you can, if you have an understanding of like, coefficient of variance and things like that, and you can kind of get it within, say, that 10%, then I think it's worth maybe looking at that particular test relative to an isometric task and maybe put those hand in hand, right? I think concentrically it's good as well to look at it if you have an isokinetic dynamometer, but just appreciate, where within, say, the task that may pop itself up, say, i.e., reacceleration on a multi-directional cut versus, linear decel, which, as we mentioned before, is going to have this high eccentric component. That's where I would kind of tend to go from that measurement. So that would be my first place that I would start, would be looking at that component. I think if you wanted to look at some additional components as well, if you have the time and you have an understanding from a testing component how to do it, maybe looking at hip extensor moment, just because there's going to be a large hip flexion moment that is required in that. So that may be a good secondary task. Looking at your knee flexor strength and kind of seeing what's going up there. I know I've heard some people say that there may be some relevance there in terms of that posterior chain component, in terms of the ability to maintain a not a stiff upright posture, but be able to kind of control some of that trunk flexion. But again, it all goes back to get the knee extensor component first, right? Like in a busy kind of outpatient clinic, as Brandon mentioned, if you've got 30 minutes, right, 40 minutes with someone, at least get that test in, right? Start there. And then everything else is the cherry on top if you have time to be able to do that, right? And oftentimes we overlook that task because it's maybe not as bright and shiny, as using a force plate system or things like that. But I think that's your prerequisite place that you start, and then you build all your tasks off of that. Does that make sense?
Yeah, I know that's definitely something that I've changed my practice the last 3 years, just making sure that we're hammering that knee extension strength home and monitoring it. So we monitor every 4 weeks just to make sure that we're on the right track. Brandon, do you have any other thoughts?
No, I think that's good. I do very similar. I'm kind of at that 4-week interval right now too. And a lot of this, it's changed so much, even for me over the past year, where I've talked to Madi about like, just, having an interest in this stuff coming out of school. It's like you have this good idea of like what things are going to look like, but that first time a patient's in front of you and they just had surgery, I feel like all that kind of went out the window. And then it's going back through the process. But a lot of that is our clinic. We have like a lower extremity functional performance test that they'll go through with people post-op. And so a lot of it's based around isokinetic testing at different speeds. So when I was first starting and we were being trained, I was getting comfortable doing that. And then really the past couple months, I've kind of peeled it back and gone a lot more into the isometrics and looking at that too. I haven't taken a deep dive as much into the eccentrics, but I have seen people like, and I may mispronounce her last name, Laura Obstadel on Twitter talking about some of these things, and like, Dan Lorenz and Scott Morrison too. But no, I mean, I think that's kind of that foundational piece of getting some of those and then trying to figure out where, different benchmarks may be, if it's for returning to running or something that's a little more high level too. Mm-hmm. And then doing that, peak torque to body weight ratio. And then as you're getting more confidence in that, looking at LSI further down the road too.
Yeah, for sure. That's awesome. So where do we go after that? What's our next milestone or landmark that we're looking at outside of that quad strength?
Yeah. So, and I will make a slight little caveat. I will say, one thing that I've been trying to do a better job of, and I think, Scott Morrison has really kind of harped on this a lot. So credit to him on this, but being very standardized in your testing approach, I think is a very overlooked kind of concept, specifically if you don't have, say, like an isokinetic dynamometer. And one thing in particular that I've been trying to do a better job of recently is sticking to what the research is doing within the context of a time limit. So I think oftentimes I say I have an ability to, or I have the tendency, I should say, to, as opposed to using like a 5-second count, like maybe I'll do a 6 or a 7 or maybe even an 8. I think that can kind of flaw the metrics from time to time when you're trying to compare that to some standards. So I just want to make that short little kind of side note that if you are doing your testing, make sure you've got a standardized process in not only your testing position, but also your procedures, the way you cue, et cetera. Those are all little things that I think can easily be taken for granted. But I think part of it is just getting practice with it, right? Just getting more rep, and then just kind of refining your process over time. So in terms of the next step, I still think it's important, keeping along the lines of what Inda King is kind of talking about, this idea of peak strength. I think oftentimes it's easy just to, as Brandon was mentioning earlier, to go isolated but not look globally. I still think there's some relevance in global. If you, in this case, try to constrain the task as much as possible, right? I'm not necessarily advocating for like a 1RM, two-legged back squat or something like that, just like a barbell back squat. I just think there's too many maybe degrees of freedom within the context of that particular task. And it may not appreciate as much load, say in this case, going to the knee extensor component as you need it to be. So the place that I'll go to, I've gone back and forth. I have a love-hate relationship with this exercise, but I've been really playing with the rear foot elevated split squat, specifically within the context of a Smith machine. The reason I like that is because I think it really helps to build in some of the inherent instability that you get from a dumbbell kind of variation of that. So I know, like on myself, when I've done the rear foot elevated squat a lot, there oftentimes can be a really instability component with the dumbbell incorporation, specifically if you or your athlete has any sort of maybe past history of like chronic ankle instability, or we obviously know there's going to be proprioceptive deficits after ACLR. So I think that's a big kind of consideration to keep in mind. And so I really like, the one arm, or not a one arm, maybe like using like a 3 or a 5 or something to predict the one, but using a rear foot elevated split squat specifically within a Smith machine to potentially use that as a proxy, James, for global peak output. I think if you have like a force plate system and you can kind of rig it to be more like a pin squat, I like that variation, just because again, there's probably a little bit better output, say relative to a concentric derivative. But again, I think if you want to take an eccentric derivative, and do that as well, I think, that potentially could be a variation, but, I like that. Not a huge fan of the split squat itself. I just think there's subconsciously, there's too many degrees of freedom that people, can inherently, just cheat the task with. And that's basically the same reason why I don't necessarily like the two-legged back squat. But what I will say, if we go back and if we look at some of Alex Natera's work, looking at kind of outputs on a single leg derivative relative and how we kind of calculate that to a bilateral task, I think that's kind of a good place to start in terms of looking at that kind of strength and conditioning proxy for what's a decent foundational strength base for power. And so that's a place that I've kind of gone to. And then it's really interesting when you look at a rear foot elevated split squat. This comes from some of the research by Mark Helm when he was doing his PhD, but he actually found that there's a very similar kind of load going through the entire extremity relative to a single leg like squat. So when we look at both of those tasks, there's about 85% goes through 85% of the body weight goes through that leg. And so I think they're relatively maybe similar tasks. And there's probably a higher demand on the knee extensor component within a single leg squat, just because the inherent, instability components. But I think you really have to kind of like take a step back and say, okay, what am I specifically looking for within this context, right? Am I looking for more kinetic, or am I looking for more kinematic? And I think that's really where you have to do a good job of understanding what are you getting out of your test. If you're testing something that has multiple components to it, what are you specifically looking at? And that's something that I've heard Eric Meyer say a lot as well. And just going back and thinking, okay, if I'm doing this test, what am I specifically looking for? So if I'm looking for peak strength, I want to ensure that I'm trying to build stability into the system somehow, i.e. that's why I choose to do the Smith machine, because there's just that inherent kind of stability with the bar. And so that's the second place that is just a global lower extremity kind of proxy for strength. And I'm trying to think of anything else that I would add. I mean, maybe something like a mid-thigh pull or something to kind of get some posterior chain global peak output. But Again, if I'm looking at something like an ACLR, where we know that the knee eccentric component is going to be the one that's most lacking, I'm going to choose a squat derivative before I choose a hinge derivative, if that makes sense.
Couple thoughts there. When you're looking at that rear foot elevated split squat, what do you look for with the shin angle of that front leg?
Yeah, so I'm obviously looking for like a forward shin progression. I'm looking for just the ability to accept load into that complex, also keeping a relatively upright trunk. Obviously, we have limitations in terms of where people are, putting stress in their foot. Susan Sigwart has shown that for sure. But I think just inherently, I'm looking for is there a tolerance? Is there a comfortability throughout the motion as we go into flexion to get that forward shin progression?
Yeah. And then what are your guys' thoughts on a single leg press? A little bit more constrained environment.
Yeah, I think that's good. I think the one thing that I kind of get a little cautious with when looking at that particular exercise is we know it's going to be a little bit more hip flexion dominant, right? Just because of how much flexion is going through that hip complex. I personally don't use it as a proxy for a knee issue. If it's a hip issue, I think that's a great test to use, just because of it's a little bit a safer place. If you wanted to look at like hinge derivative, I think that'd be a good place to start as well. But I don't necessarily use that. Use that. Just because if I going back to that, what am I specifically looking for? If I'm looking for a test that's going to give me a proxy for global orchestral strength, I have like a knee extensor bias, I'm going to go to a squat derivative versus like more of a hinge derivative.
Yeah, I like that. Any other thoughts, Brandon?
Yeah, I think that's a really good point too. And I will say I am more in the camp of right now. I do use that leg press as kind of my proxy measure. We're fortunate we have a leg press that I can almost recline into like a hack squat position too. So I can try to decrease that hip flexion a little bit. We have force decks in our clinic. We don't have a great way to set up like it as an isometric mid thigh pull, or I would be really interested in that same thing with the rear foot elevated split squat. And I've talked to Madi about these things as well. We are looking at getting some different things where we can set that up a bit better too. But from that perspective of like talking about, how you can constrain those things down, I think that that's a really good movement where they actually talked about that in the Indy King piece, where it was like, if you constrain that one piece of the movement, you could focus a little more even on the back leg too. So there's a lot of things you can do with it. But yeah, so I'm currently using that leg press, but hoping to kind of change that setup as we get a little more availability to lock that system down.
Awesome.
And another thing that I've kind of played with, it's a hard setup to do. I've tried some different derivatives because again, like at the end of the day, if you're trying to get peak strength, right, you got to have load on the system, right? When you do a single leg squat, you're limited by stability, right? And so if you're trying to get a proxy for peak strength, there has to be some sort of load derivative associated with it, at least in my opinion. Could be wrong. I'd be glad to discuss that with somebody, but that's kind of where my thought process goes. So in terms of a potential alternative, I know there's been discussion about using like a single leg wall slide as a potential proxy metric. I think that can potentially be it. Again, the limitation with that is points of stability, right? If you're doing a single leg derivative, that's a really hard test to do. There's obviously a high knee sensor component going through it, but there's a big stability component too. So I've almost played with the idea of trying to imagine how to picture this. If you were to put your back on a wall and then your one leg is, if you have like access to like a door frame, right? And if I'm standing with my back against the wall, like I'm about to do a wall sit, but I've got that rear foot kind of back on something, right? So there's an open space behind it, almost doing like a rear foot elevated, almost wall slide, and potentially using a proxy like that. So I think that could potentially be a cool derivative. Using like a free motion machine where you kind of have the access in the back to put that rear foot back. I think that would be a good way to kind of really constrain the task to make sure they're maintaining that upright trunk position and see, do they have comfortability through that knee extensor component in terms of bending. I think the challenge with, again, as we increase degrees of freedom, that's where that trunk flexion is really, really hard to control for. But I think if you do a good job early on with the integration of that task, I think from a testing perspective, it gets a little easier to do versus, just kind of going right there as a test per se.
Yeah, and I really sorry, I was gonna add really quick I really like that one position that Maddie's mentioning too with door frame, because Scott's got a really good video of that, and I have used that where you can basically get everything from the chest down to the knee on that front side, if that's the same thing you're talking about. And you're not going to be able to kind of flex through the hip or anything, so it can be really demanding on that back leg too. So that is one, and I'll use that a lot, like at the high school, as if say the weight room's full for 3 hours when I'm there and I just can't get somebody in. So that's kind of a good like low equipment option you can try too.
I like that's important to use that low equipment option, because not everyone has access to the high tech and fancy stuff.
And this is just one more kind of final thought. I think a good measurement as well, if you have access to it, would be looking at the repetition within the context of a velocity measure. I think that could be a really helpful metric as well, to make sure that if you're measuring peak strength, maybe you have something to potentially confirm the intent behind the movement, right? I think that could be a really good additional thing if you have access, to it.
Yeah, and that kind of brings us to our next point. So say the athlete has demonstrated that they have adequate strength. Where do we move to next after they have that strength?
Yeah. So if we go back and if we look at, progressing through Endeking's article, I think oftentimes within the context of exercise prescription, this was something I really had to kind of take a step back and over the last, year or so, really conceptualize the capacities that I'm trying to drive within clinic. I think it's very easy to get caught up in the strength and conditioning world and say, okay, am I trying to get speed strength and strength speed and power and reactive strength? And it's like, before you know it, you've got four different, you got the same exercise in 4 different ways, right? And it gets very, very confusing to be able to do that. So for me, I've really tried to take a step back and really conceptualize what are the big kind of foundational pieces of athletic performance. And I think if we have peak strength, if we have explosive strength or power and reactive strength, I think we're doing a pretty good job of getting a decent, athletic performance piece, especially when we have limited time, right? And so that being said, the place that I'll go to next is a proxy for power or explosive strength. Obviously, if you have access to an isolated way to measure this, right? As we mentioned with peak strength, that's a place that I'll start first, right? The way that I would go with that, again, it seems from a reliability perspective, from what I've heard and what I've read, it seems that the isometric test would be a place to go, but specifically doing that with an isokinetic dynamometer, just because like a load cell or a handheld is just not going to have the sampling frequency to be able to measure that appropriately. It'd be great if those things come out soon. But if I'm going to measure an isolated output, I would do that with an isometric test via an isokinetic dynamometer. So that's the place that I would start to first. Most people aren't going to have access to that, unfortunately. And so the next place that we're going to go to is looking at a counter movement jump. That's where I would go to. I think that's a great test. And I think the first point that I would bring up within this is the same point that we brought up with the squat. If we're doing a single leg counter movement jump, right? I think we have to appreciate that there just may be some limitations there from a proprioceptive stability component. And that may limit the inherent output. Again, I think you probably have to go there right now, potentially, to compare it to relative norms in terms of what people are looking for. But this is where, to Brandon's point, a force plate system is, I think, very, very handy, because if we can build stability into the system, i.e. a 2-legged derivative, but have a way to look at a potential from side to side, albeit we're not going to have the best proxy for seeing what's going on actually within the limb, that could be a potential consideration, just because that's what's potentially being done when we're comparing it to deceleration tasks that we'll kind of dive into a little bit later with Damian Harper's work. So a place that I'll go to when looking at explosive strength, potentially this for right now, is actually a rear foot elevated counter movement jump. I like that as a potential place, just again, because it may take out some of the kinematic demands associated with a single leg task. So again, if we're trying to measure kinetics or a capacity versus more of like a movement, variability coordination component, then I'm trying to build stability into the system as best I possibly can. I thought about the idea of doing that within the context of like a Smith machine. But I tried it on myself and it didn't really go too well in terms of the bar slamming on my back, and my back was hurting for a couple of days. So that was not the greatest thing that I tried personally, but I like the rear foot elevated position. But again, I think there's potential consideration in there for the single leg derivative, just because that's within a healthy cohort people are looking at. And I think, if you're looking at that or comparing it to a task, that just may be some considerations you have to kind of keep in mind. But do you guys have any thoughts on like a rear foot elevated counter movement jump versus a single leg counter movement jump?
Are you doing that counter movement jump on a force plate?
I'm not.
Foot? No,
I'm not. No.
Okay. I guess my biggest question would be, how are you measuring that? How are you determining what's effective?
Yeah, so this speaks to the limitations that we oftentimes face within a lot of outpatient clinics, right? I'll go to the My Jump app. I think that's a great app. We know it's valid and it's reliable, which is good. And actually, I think there's a recent publication coming out looking at its new metrics, looking at like time to takeoff. And so I'll specifically look at jump height. There's potentially, and I've been kind of diving into this a little bit, using jump height as maybe a proxy for isolated concentric output. And then looking at John Harry's done some work at Texas Tech looking at time to take off, or I think they termed it as maybe time to jump within their study as a decent correlation with eccentric RFD. And so I'll go back to those particular metrics, looking at jump height and time to take off, which both can be measured with the new My Jump app. And so that's the place that I'll go to there, just with the limitations that I have. But if I was looking, if I had a force plate system, I'd probably be a little bit more specific. I still think, jump height is a really good proxy. I'm not, like, I know people talk about, power or impulse, and those are good places to start as well. I think you just have to appreciate the component parts when you look at some of those things. So that's where, again, to Brandon's point, if you have the ability to identify, if you're looking at something like impulse, but the ability to look at time, right, then I think that's an important consideration. I used to think power was where I wanted to go, like looking at like a peak power proxy. But then I realized, power can be compensated for because it's a force derivative. And so someone could be, forceful, but not necessarily have the rate component that they need, right? So I've kind of shied away from looking at power. I know there's been conversation that, that's probably not a place that we want to go as well.
Awesome. Yeah, I'll have to check that out. I've never thought of that, never tried it. So definitely something that I'll try maybe this weekend. Brandon, any thoughts?
No, I'd be curious to try that as well, because we're currently trying to peel back a lot of things with our force deck system, because that's not a component part of like our actual functional performance test that they'll run through, that our surgeons are familiar with and things. We're trying to, a couple of us, start to look at like revamping that. So one of my coworkers in particular, it's Nick Mahaffey. So I know Maddie knows him really well too. So
shout out Nick.
Yeah, he's looking a little bit more at some of the force deck stuff right now, along with Ryan Kimball that does our FIFA program. And we're trying to like come together and see what we're going to be able to work with on this too, because it just gives you, you guys probably know, it gives you so much information, like a lot of testing stuff, and then it's what's actually useful here and what can we do too. So no, I'm definitely, as usual, going to steal some of Maddie's ideas and try it out.
I like it. Anything else with that explosive measurement?
I just wanted to make a quick little comment, and this speaks to Daniel Cohen's work. I think he's out of Columbia, if I'm not mistaken, but he had a really good, about 2 years ago, there was a good kind of series of articles that were written out of the Sports Medicine Journal of Aspetar, and they looked at a variety of kind of counter movement jump metrics. So I'm just looking at a quick graph here, and they looked at eccentric deceleration RFD, they looked at concentric impulse, and they looked at jump height, and they looked at those kind of single leg counter movement jump asymmetries at 6 and 8 months respectively. If we're looking at the 8 month kind of asymmetries, it's very interesting to see when you look at within this chart, which I'm assuming is just from like kind of case studies. Eccentric deceleration RFD asymmetry was probably somewhere around 17.5, maybe 18%. If you look at concentric impulse, it's maybe around 7.5, 8%. But then when you look at jump height, which we know is going to be a concentric derivative, that goes all the way back up to almost 14, 13.5, 14%, right? So, when you look at something like impulse, you have to be just understanding of its component parts. And I think that maybe speaks a little bit to jump height with maybe that relationship with kind of concentric RFD. And maybe it's a little bit, it's a good metric to start with, at least in my opinion, especially if you have limited utility in your testing metrics, so that's a place that I would go to alongside time to take off. And then again, you try to constrain the task as best as you possibly can, right? And then you just kind of make sure that you cross your fingers and hope they're putting load in the right places, I guess.
Yeah, and I know we probably thought we were going to talk about this a little bit, but thoughts on the single leg hop for distance testing? Are we still doing that, or have we moved away from that?
So I will say that I think the single leg hop test can be good, albeit I think we've got to maybe reverse engineer our thought process. And I'm waiting for some studies to come out to say, could there be something like a time to stabilization proxy that you could use as maybe like a measure of eccentric RFD? We do know that that group from Aspetar has basically just shredded the idea of using the hop distance as a measurement, which I think, potentially if you wanted to look at it as maybe a proxy of the hip or the ankle, which again, if you have maybe one of those pathologies, I think it becomes a decent test, right? Just because of the degree. But then you have to appreciate that there may not be like a whole lot of a difference relative to the percent demand of like a counter movement jump, right? So I think it kind of comes up to maybe your comfortability with the testing. But I think until we have a better metric, like a time to stabilization metric or something, very similar to how we kind of use time to takeoff as a proxy or we may be able to use as a proxy for eccentric RFD. I just don't think there's a whole lot of utility in that test personally. I don't know, Brandon, do you have anything?
No, I mean, I'm in a similar camp because it's still part of our like functional battery that they'll go through. But the thing that I've been kind of playing with the most is trying to figure out where the amount of exposure to that is going to be before. So like if I have someone I'm taking through the rehab process, I know they're going to do it at some point.
Sure.
And like a lot of my testing stuff, I've kind of fallen into, do the basics, get them exposed to these other things, build these physical qualities, not necessarily like train to the test. I'm trying not to do that a ton.
Sure.
So it's still part of it, but lesser. So like, we're going to practice this 100 times. And like, it's more of, if I can get these underlying things set, let's just go see how you perform. And then, keeping in mind all the things that can happen with your dynamic system of all the other degrees of freedom you've got in that test too. So I'm kind of in a similar thought process too.
James, I think an interesting thing, I just recently found this the other day. When you look at a single leg hop for distance, when you look at the external knee flexion moment of that task, it's actually very similar to a linear decel task if you're doing it with a maximal effort. So oftentimes, I will see people doing single leg hop as an intervention, pre-return to run. And I'm just now with having that information, I'm just kind of shaking my head and thinking like, if that is requiring a very similar knee extensor, if the intent is there, right? If the maximal effort intent is there and it's requiring a similar knee extensor demand, why in God's name are we throwing that in at 4 months? Like that was a real eye-opening thing for me the other day when I was like, looking through some of the literature and I was thinking, oh, wow, like this requires a really high output, hence why it can be a good test, right? And why I think we need to do a better job from a research perspective of maybe understanding some metrics on that decel component. I think it can be a really useful proxy for that. But I was just like thinking, I was like, man, like how many times have I incorporated things like hopping or horizontal hopping early on in the rehabilitation process, and the person had nowhere near maybe the underlying isolated capacity to be able to perform that task, and they were showing me that they could do it, right? But the reality of the situation is there was probably just compensations going everywhere,
Yeah, I agree. We just have to know what we're measuring and what we're using the test for. It's a great
Exactly.
exercise, great tool, but just know what you're measuring with that test.
Right.
So moving on, is there anything that we need to touch on before we go to the reactive strength?
No, I think that's good. Like I said, I think Enda King has a pretty good idea. I'm trying to think I was thinking about something the other day of going back to the kinetics versus the kinematics and trying to appreciate that. Maybe that'll pop up a little bit later, but I think one thing to appreciate as well, and maybe we'll touch on this just as a whole at the end, but I think we also need to appreciate, limb symmetry within all these different measurements. And maybe we can kind of just, touch on that at the end of today's discussion. But that's probably where I would go. I think the single leg counter movement jump or the rear elevated split squat counter movement jump, I think are good places to go to as long as you understand those component parts. And I think to that point, when we look at something like an RSI, like RSI mod or something, I know Chris Bishop has talked about this a lot. Don't just look at a ratio by itself, but understand its component parts before if that's something that you're considering within your test. Don't just say, oh, this person has an RSI mod that is good relative to normative standard, but understand the component parts. And I think that's something as well from a research perspective we might need to do better within a healthy cohort of saying like not just the jump height, but also looking at say like time to take off, which I know is a potential place in some research groups.
Okay, so moving on to reactive strength, we know this is usually the quality that takes the longest to get, and some people never get it back following ACL reconstruction, which limits their performance. So, Maddie, what are your thoughts on reactive strength testing? And we'll go from there.
Yeah, so to your point, James, about this quality being very much limited for years, right after the surgery. I think Matt Jordan has some good data on this that came out past year, and his group is specifically focused on alpine skiers after ACL, and I think they found that this particular quality was depressed all the way up until about 5 years after ACL reconstruction. So I think it's one of those things. Just because someone's doing your pogo hops doesn't mean you're getting your reactive strength quality back, right? That's where you really have to kind of differentiate between extensive and intensive plyometrics, which if you haven't listened to part one, go back in part one. I think we kind of talked about that a little bit in terms of the difference between the two of those. But so I think reactive strength is a very important quality. And again, I'll say it a million times, but going back to understanding your isolated knee extensor component, this becomes really important within the context of reactive strength. As we mentioned before, I think we had talked about it prior to the implementation of counter movement jump testing, but reactive strength actually requires a very large knee extensor component, very, very much in upwards of, near maximal effort stuff. And so really, really important to keep that in mind that prior to the integration of intensive plyometrics, I think extensively, I think as you're getting close to return to run, that's a potential consideration you got to keep in mind. But for intensive plyometrics, keep in mind that there has to be a decent knee extensor load to ensure you're performing that task, relatively appropriately. With that being said, I'll keep things fairly simplistic. As we mentioned before, within the context of explosive strength, I'll probably do something very similar within the context of reactive strength. I'll look at maybe a rear foot elevated kind of variation, or I'll do a single leg variation. I think one thing you've got to keep in mind within this particular task is the height of the box, and for a couple of reasons. I think the first thing is you have to ensure that the height of the box doesn't almost create like a super maximal eccentric. There's a variety of papers using 8 inches or 12 inches or things like that. I personally like 8. I think 8 it starts to kind of get into that intensive round, especially as you're getting into a single leg derivative. So I like a single leg drop jump from about 8 inches or so. Again, whether it's a rear foot derivative or a single leg derivative, I think that's kind of up for your choosing, and what you feel most comfortable with and how you want to maybe compare that to some normative data. But I'll go there. And I think what you have to appreciate here, just like we talked about time to take off, right, within the context of the counter movement jump, is you've got to look at ground contact time. right? You have to look at that, because if you're, I don't know if I necessarily like look at 250 as you got to have 250 milliseconds from an intensive counter movement or intensive drop jump. But I don't want it, pushing more than like 275 or something like that, but you have to look at ground contact time, because if not, then it just kind of defeats the purpose of it being a reactive strength exercise. And hence, if you're doing like a 12-inch box, you're probably creating for a super maximally eccentric, and therefore your ground contact time is going to be 320, 350, and kind of defeat the purpose of that, right? So I think you've got to go there first. I can't remember. I feel like I've seen some research to kind of show that ground contact time's a little bit, or there's a decent association with like stiffness, which may relate more so to the isometric component of the contraction, but I can't remember entirely off the top of my head. But I would go there first. I would go ground contact time. Make sure they're getting that first, right? Because if you're getting jump height at the expense of ground contact time, then it just doesn't make a lot of sense to me, And so I'll go ground contact time, make sure it's within a relative range, 250, 275, somewhere in that range. And then I'll look at jump height for some similar reasons to why we said we looked at it as potentially a proxy for concentric RFD in the counter movement jump previously. So I'll go there and just make sure that, I think an important thing with the drop jump is the cueing of it, right? Making sure you're getting off the ground as fast and as high as possible, not just as high as possible. So it goes back to what we said initially in the conversation about making sure that you're standardizing your testing approach and making sure you've got that down. But that's what I'll specifically look at in that task.
Yeah, I like that. And then in terms of standardizing it, do you account for how tall the athlete is? I know I've done some studies where in my residency where we used a double leg drop jump, and everyone had to drop half of their body height away from the box. So do you look at that at all, or is it just pretty standard?
I am actually unfamiliar with that. Would you mind kind of dive into that for a second, like why that was?
So it was pretty much based off of the landing error scoring system. Okay. And they standardize it per athlete. So everyone dropped off of the same height box, but the distance they dropped was just half of their body height. So in the study that we did in my residency, we just got everyone's height and adjusted the box to the landing spot. So if someone was 6'10", they were jumping further out than someone that was 5'10".
Oh, are you talking about the horizontal distance?
Horizontal distance from the box that they're jumping out of.
Gotcha. I thought you were talking about vertical height.
Oh no.
No. That's why I was like, I haven't heard anything on that. No. Yeah, no, I don't. Because going back to what we said earlier about the horizontal component associated with or the knee extensor component associated with the horizontal task, right? Like I don't. Like what am I trying to measure in that task, right? Like what am I trying to get? I'm trying to get a reactive strength derivative, right? Which is very ankle dominant, right? And so like for me, it just makes sense to come right down and right back up versus adding like a horizontal component to it, just because I think if you add that horizontal component into it, now you're adding a large knee extensor component to the equation, just because for the reasons we stated earlier, and therefore it may influence the ankle derivative component, if that makes sense. So yeah, I'm not a huge fan of that variation. I think there's just it's measuring too many different things. There's too much going on in that test versus just horizontal, vertical, separate them, XYZ.
Perfect. Yeah, I like it. Brandon, any other thoughts?
No, I think that's a good point too, because and especially if you do have access to like a ForceDex system or Hawkins Dynamic or something like that you can use, is kind of going back to Maddie's point about understanding the underpinning things for something like impulse, depending on which characteristics you're going to look at from the testing too, because if you have that increased ground contact time and you are looking, maybe you just decide you're going to focus a little more on that impulse piece too, but you're getting that longer duration of time that you have to actually exert that force, then that could be one of those things where you could say, oh, they actually look symmetrical, but if you're not hitting that piece, if you're at 250 or 250 milliseconds on one side and 315 on the other or something like that, and then a similar thing, like that's something else we're going to start to try to look at too, because the landing error scoring system is part of the like clinic based functional return to sport testing right now too. And so one of the components that's actually really interesting to me to hear that part of the discussion is we'll do kind of the horizontal displacement measurement too, just based on things that they've seen or they've talked about. And we've talked about, okay, well, why can't we just add in the force decks and try to get a measure of that? So then that's another piece too that's actually really interesting that I'll have to talk about a little bit more, because thinking of that demand and how that can change a bit more. But yeah, really interesting.
I think you just have to, again, really understand what are you measuring, right? Like a lot of those tests, they're measuring the kinematics, right? They're not necessarily getting to the kinetics. And so again, just keep it simple, right? Look at what other studies are doing. And most studies within the strength and conditioning literature are doing a peak measurement, a counter movement jump, and a drop jump. And I don't think just because we're in physical therapy or we're in the rehab profession, I don't think we need to change that, right? Just keep it simple, go to the same metrics, get your global picture of athletic performance, and control the things that you can control, right? Control your capacities, and then hopefully as you improve those capacities, the kinematics will come with it as well.
Yeah, I like it. Keep it simple. So
keep it simple.
Where does reactive strength show up, like on the field with athletic type movements? Kind of going back to where we first started, that horizontal deceleration. Where does all of this align, and why does it even matter?
Yeah, that's a great point, James. And this really brings up one of Damian Harper's papers when he looked at specifically drop jump and its relationship to deceleration. I don't know if they looked at, I don't specifically within his paper if it was looking at deceleration impulse or deceleration distance. I can't remember off the top of my head, but there is going to be a high demand throughout the entirety of that, right? It's going to be very much manifested within that reacceleration component, just because of the pure nature of pop and push, as Rich Clark would say. But it's going to be prevalent throughout the entire kind of deceleration component. There's been some really cool stuff where Damian has looked at kind of early decel versus late decel, and he's kind of looked at that. Looked at the ability to kind of control early decel and kind of see how that kind of manifests itself within the context of late decel. Because his thought process is, and again, I hope I'm quoting him correctly here, but his thought process is if we can do a better job of controlling early, right, and that'll kind of set us up for late decel, right? And I think within that drop jump study that he did, when he looked at reactive strength, he found that it had a pretty strong association or correlation with early deceleration component, right? Which too, in a previous study that he did, had a high rate relationship, whereas late deceleration had more of a relationship with high peak. And so that's why I think you need kind of a combination of you need everything, right? You need all these different measurements and their relationship to different parts of deceleration. But based upon Damian's work, I would say that it's probably prevalent throughout the entire deceleration component, but maybe has a higher association with that early decel, which I think if we can control that, and specifically within the context of like observational work that we're doing in the clinic, like how would I look at that? I think if we can get ourselves if we can really just look at one metric, right? And we can talk about this for a second, but if we look at something like the cutting movement assessment score, right? And we see there's like 7, 8, 9 different things we're looking at. There's no way visually that it's just it's able to do that. I mean, I guess, visually, if you recorded it, you could do that, right? But from a time component, there's no way you're going to be able to look at all those different things. And on top of that, be able to address all those different things, right? So what I specifically look for is I'm a firm believer in center of mass displacement. I think if you can get center of mass displacement in an appropriate position, then that's going to set us up for success throughout the entirety of the rehabilitation or the entirety of the deceleration process. And so if we can get ourselves in that early decel phase, to what I say is, I'm trying to think how I framed it the other day. It was, drop, break, and slam. If we can get our center of mass to come down just a little bit, start to subconsciously put ourselves into a deceleratory position, break, which is get that very quick or rapid eccentric deceleration component, and then slam, which is again putting on the brakes. That's specifically what I'm looking for in the context of when I'm coaching and cueing people is, do I see a rapid kind of triple flexion somewhere within that deceleration component prior to the ending of the task? So for me, it's about center of mass displacement. I think again, if we have that eccentric rate component, and if we throw in some of Damien's work looking at the elasticity of the reactive strength, I think maybe that helps us get into that center of mass displacement quickly, right? And that maybe helps set us up to put us in a position to be successful in the late decel. Rich Clark, I've quoted him before in this topic or this conversation, but I'll quote him again. He talks about this idea of oftentimes ACL injuries, they might happen because our body is in this kind of multimodal kind of approach. So as we're kind of going into a cut, right, our body is still in an acceleratory state, right? We still have an upright posture. We still have that 20 to 30 degrees of knee flexion because we're still focusing on concentric intent, and then we're trying to at the same time when we go into the cut, right? So I think in terms of like just going into that a little bit more, so picture someone going into a cut. If you go back and if you look at Zach Wilson's recent injury from the Jets, if you go back and you look at the couple steps prior to his injury, which I think I think personally he was probably a step away from an ACL just by looking at his mechanism of injury. And I think if you go back and you look at his injury report, he had a bone bruise that was in it. And I think potentially there was maybe some anterior tibial translation that might have happened there in association with his meniscus. But if you look at his injury, the steps preceding his plant leg, he's still in an acceleratory state. He's not getting his center of mass a little bit lower to basically set himself up to be able to break efficiently. And that's where I think if we can just work on one component and get one component really, really good, just like from a capacity standpoint, if we can get one thing really, really good, which is that eccentric knee sensor component, I think we do a really good job. I think that's the best thing that we can do versus trying to address 7 or 8 different things. Like, I think if we can get center of mass displacement good and get into that triple flex position, I think that helps control with trunk flexion positioning. I think that helps, or like compensation. I think it helps with valgus positioning. Because some of those associations, right, they're probably gonna be absorption through the system, right, and try to reduce that knee eccentric load because we haven't done it so far. And so for me, if we can get that center of mass well, I think we're in a good position. And Neil Welch actually has a good paper on this too from the Sportsmith group, which we've been talking about with Enda King. Go back and read his for anyone that's listening to this. He talks about center of mass displacement being a really important factor. I think he actually had a principal component analysis which looked at the really important relevance of center of mass displacement. So do that clinically in terms of on the field when you're going through your on-field or pitch work, but also appreciate the component parts that I think may lead to doing a very good center of mass displacement, which is potentially eccentric rate of force development and that reactive strength component for Damien Harper's work.
Yeah, to sum that all up, I think it's important to make sure that they have those neuromuscular properties, because if they don't have those neuromuscular properties, you won't be able to coach them into that good technique. So
yeah, they're gonna be cheating, That's why, oftentimes within the context of ACL rehab, right, I've been really questioning this idea. Is our focus getting the athlete back as fast as possible, or are we trying to get the athlete back as safe and as fast as possible? I think ACL rehab needs to go from a 9-month rehab process to an easy 12 to 15-month rehab process, just because of the length that it takes to get back those capacities, And I think if you look at some good kind of longitudinal work that's being done that just came out of like the training house from the Twin City group, they show some pretty good data across the time that really kind of shows that we're not even necessarily by that 9-month mark. We're really not even getting to what everyone is hoping for, which is that 3 Newton meters per kilogram, right? So if you go back and you look at that Matt Tavener paper, in their return to sport, that this is, top level female soccer, 15 months at elite level. And we're trying to push for 8 or 9 months with our high school kids, right? Maybe their strength levels are maybe the strength levels are better than what the strength levels are at the college and the elite level, but I would question that. And subsequently, I mean, that's a whole nother conversation, topic, but I think, strength reserve going into a surgery is a really important consideration for how quickly we're going to get those capacities back. And one thing that I've kind of started to wonder is, if you have someone who has a lower strength reserve, whether it's, male or female going into a study, right, relative to maybe normative data or, task specific data, is that person just inherently going to take, are they just going to need more time, right? Because you're trying to get that person back to their prerequisite capacity, and then you're trying to take them to another level, right? Versus their who has a larger strength reserve, you're just trying to get maybe back to their pre-injury level, maybe a little bit more, versus the other person's like, you got to go even further, right? So I think to get those capacities back, and even we may not even get them back again really well at 15 months, but I think that's all to say, like, we need to push things back from 9 to 12 to 15. It may not necessarily reduce re-injury risk, but I would hope that getting those capacities back maybe allows for a better expression of movement options to as Scott Morrison would kind of talk about. Along those lines, just look at, I heard that Alonzo Ball is going in for another surgery, right? Look at that rehab process. And I think, I saw this with another athlete, we're looking at just accelerating everything, right? Someone goes in for a partial, people aren't getting their quads back after a partial meniscectomy until 6 months. There's good data to suggest that from a systematic review, right? We're trying to push people back 4 or 6 weeks. And that's what they were talking about initially with Zach Wilson coming off this bone bruise and partial meniscectomy. So I don't think it's just ACL, but I think it's just everything we need to be doing a better, giving it just more time, to be able to get those capacities back.
Yeah, I definitely agree. And that's why it's so important to, as we dive into this paper and kind of finish up, just begin with the end in mind. Know what
Exactly.
rehab looks like. Know what you're looking for with the different physical capacities, and then systematically and gradually work your way through those so you don't miss any steps.
Absolutely. I think that's a critical component. Reverse engineer, right? Zach Baker from Rehab Reform talks about this a lot. And that was definitely a thing I took away from him, of just reverse engineering the process. Think of what you are in mind and then work backwards from there. I think that is where we need to go from a research component. I think right now we're trying to go forward and try to kind of meet the end. I think we need to start at the end and kind of work our way backwards per se. So definitely good reminder.
For sure. Anything else, Brandon?
No, I think all that's really good, because and then you can get through a lot of different points of conversation. And I know people have drilled this home before, of kind of like that pre-injury level, like what was it? Because I know like my football players, they're like, this was my 1 rep max back squat, deadlift, everything. And then you get another athlete, and it's, if you're thinking more of, and, having an interest in like long-term athletic development too, it's really interesting. And you'll have that high school athlete who's never touched a weight before, or so then you're starting with a blank slate, and you've got this, 12-month rehab process that you're getting ready to go through too.
Right.
And that gets interesting, because I have a lot of conversations with families about these things of, just recently, it's like, oh, okay, well, senior year basketball season's coming up right at about the 6.5 month mark. Like, what do you think? And I'm like, well, my honest opinion is, if we're talking about someone who's 17, ideally we've got this at least like a full year, and trying to go through and frame it almost more of a, it's tricky, you're going to miss part of that. But also, if we're thinking about this of long-term knee health, long-term quality of life, all those things too, which
right.
And I joke about it a lot, but I'm like, if I was 17 and someone was telling me that, I also don't want to hear it. Like, yeah, I remember being an athlete too. And but so it's definitely very tricky with a lot of layers, but I'm in that same camp of, if you have the luxury and you can extend it out, and then you can frame it to people more of, we're not just holding you back to hold you back. Like, we want to get you strong and fast and explosive and all those things you want to be as an athlete, and take more time to do that. So no, I think those are all really good points too. And then just thinking about all those other layers that can come with it.
Yeah, I think as crazy as it sounded when Tim Hewitt put out the 2-year thought process, right? And that was more, I think that was more, I think that had a biological component, but also from a neuromuscular component. I think that's what he was advocating for in that paper that he was involved with. But, you know, there is validity to that to some degree, right? I mean, at the end of the day, it is a joint decision that you're making, right? With the athlete, with the family, with all the stakeholders that are involved, right? And I think we just have our responsibility as rehab specialists and rehab coordinators is to make sure we're putting our athletes in the best position possible with the decision that they want to make, right? Chris Juno has been really kind of influential in this thought process of, I'm not going to tell you when it's okay or when it's not okay, but I'm just going to help you navigate, be almost like a risk manager is kind of how he had mentioned it to me. And I really like that thought process of, like, I'm not going to tell you, I mean, obviously we have guidelines that kind of help us, say, hey, we might not want to go before that, right? There may be cases like you're saying, Brandon, where you've got the high school athlete where it's their senior year, they're a senior in college, and you're like, hey, like I want to do this, and you're like, hey, all right, well let's try to get you there as best as possible, right? And that's the decision that the athlete is making for themselves. But I think at the end of the day, my goal is to reduce that risk as much as I possibly can, and really just, I think this speaks back to the education component and just really ensuring that we know what we're talking about from a capacity standpoint, and have a better conceptualization of that to allow our stakeholders to make a more informed decision for themselves. So definitely is a complicated road to try to navigate, but I will say that the more that you give your athletes reasoning behind why you're doing what you're doing, the more they buy into, I don't want to rush this. I want to take my time with this, as opposed to just arbitrarily saying like, oh, I want to get 2 Newton meters or I want to get 3 Newton meters. It's kind of like, no, I want to get you there because this is what the task requires, or this is what has been shown to reduce re-injury risk, et cetera. I think having sound justification for doing why you're doing what you're doing is really important to building that therapeutic alliance and getting them to really say, okay, yeah, it's been 9 months, but I'm okay if I push it back to 12 months. Like I'm not going to try to rush this thing,
Yeah, I think that's a really great point, because the one thing I've really noticed is when the things that may not look quote unquote as functional, people may have questions about like isolated capacity testing, but right. I've really found, and again, I've not been doing this long, but when you sit down and you walk through this with, anyone from younger athlete to older, and kind of explain the process of like, maybe this is why I want you to hit X number before we start running, or before we start whatever the next thing is going to be too. People seem pretty receptive to that too. I don't think it's a thing of, that every now and then it's like, oh, well, this doesn't look like, the task I'm trying to do. And it's like, okay, well, let's explore that a little bit too. And so that's where, you can break it down and explain it. And I think people really appreciate that too.
Yeah, for sure.
Yep. And then just set those expectations early so they understand what's going on.
Yeah, I really I've been trying to, Brandon and I were working on this we had talked about this when we were doing his capstone, but I think what would be great would be, post-op day 1 or pre-op or something, patient has a roadmap of what the entire rehabilitation process looks like, and that's agreed upon amongst all members of the interdisciplinary care team, so everybody's saying the same message, right? I think if you have it like go back to Matt Taubner's model, if you kind of look at his model where it's kind of gives the time frames of testing they're doing, I think if the patient could have that on day 1, it would solve a lot of the communication that we see amongst everyone, and maybe help the athlete too, and just the the family, et cetera, everyone, to say, okay, like let's maybe push this back a little bit longer, at least have those expectations in mind to say, okay, this is how long it may take to get those capacities back.
I agree. That sounds like you have a in-service project to work on.
Yeah, I've been working on this currently, so it's awesome. It's a lot more complicated than what it seems like.
Yeah, for sure.
I've piggybacked that off of Maddie some too, because I'm really interested in trying to push for more pre-op stuff, because it's crazy. I'll always ask, like, post-op day 1 or 3 or whatever day they're coming in, just what's your understanding of what the next year is going to look like, and then you get a wide variation of that too. So I definitely think that like a pre-op roadmap, a little bit of testing stuff would be, even if it's just one visit really helpful. So
For sure.
For sure. All right. So if anyone's listening and they really want to get up to speed with where you guys are at in your knowledge of ACL performance testing and rehab, what resources would you recommend for someone to take a look at?
Yeah, so I think a couple good places to start, as we've been kind of highlighting a lot in this article, is that End to King piece from Sportsmith. I think that's an absolute great piece. It really kind of highlights all the different parts from an athletic performance back that we need. It does get a little detailed just because of the center that he was at. He had probably the luxury of testing equipment that a lot of outpatient clinics don't have. But I think there's a lot of pieces in there that that we can measure, even with limited utility. So, for example, like what I end up using is a Tindeck load cell in the My Jump app, and I can do that all on my phone right there. It's going to give me my peak measurement. It's going to give you my explosive strength measurement, and it's going to give you my reactive strength measurement. I have everything all I need right there, right? Having access to the isokinetic dynamometer, having access to force plates, that is, if you have it, by all means, go for it. Just because of it's going to give you the sampling frequency of those are going to be, the gold standard, right? So if you have those things, definitely use those things. But I really like that piece that he wrote as a place to start in terms of conceptualizing the entirety of all the different metrics that you need to look at. So again, I think when we look at end stage rehab or introduction of decel work, et cetera, we're just looking at way too many things without necessarily having good justification for why we're doing what we're doing. Going back, I think hop testing is a really good example of that, right? We're doing it, but we don't really know what we're getting out of it, and I think there's probably a lot of other tests that are like that, or there's a lot of tests that maybe they, to some degree, they look at some of the same stuff. So as we were mentioning before, like being able to identify a single leg press versus a rear elevated split squat, et cetera. Like I think you need to just understand, as you mentioned before, James, just like understand your test, right? And really try to simplify the process, keep it simple, understand your athletic performance parameters, and go from there. But I would start there. And then from there, I really like some of the pieces that's coming out of the Aspetar group. I like their pieces in terms of what they're looking at from a counter movement jump as well as a vertical jump. And then from there, I would actually shift some of my work actually to the strength and conditioning realm, looking at Damian Harper and looking at kind of his background from a deceleration perspective. He's one of the few people that I think has really been diving into that concept, along others like Tom DeSantos, et cetera. I think those are really good places to start. I think they've got really good understanding of what that specific task looked like. And as we mentioned at the beginning of this podcast, I think if we can do a better job of appreciating linear deceleration, then I think it'll better set us up for success throughout the rest of the rehab process and return to sport as a whole. I think we can look at things like a 505 or, if you want to look at some of those, but I think you just have to appreciate, like, when you get into that task, right, it's just going to be task specific, right? So if you're doing a 505, you're getting an idea of 180-degree turn, right? If you want an idea for how they're going to perform, how they may perform, I shouldn't how they're going to perform, because it's totally different within testing versus sport. But if you want to get maybe a rough idea of what they're going to do from a 90-degree cut, do a 90-degree cut, right? So if you want to look at a task, just do the task itself, right, and see how they perform. But I think that it's hard to manage those things just because there's just so many movement options that people can select within sport that I don't know if that's where I go to first personally. As we mentioned before, control the controllables and have an idea of what that process looks like. I think it's a little bit easier to manage, and it's easier to measure too in terms of progression. You can see that kind of steady approach over time, contact time, jump height, peak strength, et cetera. That's where I think you need to go. So those are just some general resources that I would kind of go to, in addition to any other resources that we mentioned maybe during the first podcast.
Perfect. Brandon, any other additional resources or people that you follow for this information?
Yeah, so I think all those are great. And specifically to some of the kind of relevant stuff we talked about, like Madi mentioned Tom DeSantos' work, and then some of the stuff from Philip Graham Smith. So I know we talked about that a lot too when we were going through like the capstone stuff.
Yep.
Backing up to some of the foundational pieces, like Eric Maida has been a huge resource of just information, like to his course when I was in school. Was exposed to him really early in PT school, which can also be a bit rocking with some of the things you might hold true, but it's very helpful after you get through that part of it. But basically when I interact with students, I'm like, just go read everything you can find. He's put out some free courses now. Scott Morrison, all of his stuff, his course optimal loading is incredible, and he kind of led me down that road of getting a 10 deck too. So if I'm at the high school, that's what I'm using. Nicole Sertica, somebody else, has a lot of great information. And she really helped to break down, at least for me, like when I was trying to figure out more of this intensive, extensive stuff like Madi had mentioned too. So those are some really good resources just in general. So like courses they've created. And then I know too, like Vien Vu has put out some things. He was the fellow at Wake a couple of years ago too. So just any of those pieces, you're not going to go wrong, kind of getting into that too. And then there are some other things where people have put together just different collections. Like Scott's got that where he's kind of archived some stuff. So anything you can find that's related to the strength and conditioning piece too, like Madi said. But I think if you go read, especially like a lot of the stuff or like PT Inquest, like go through those episodes, and E3 Rehab had a really good podcast with Eric Merritt too. So go through all those things, you'll get a good foundational understanding.
And then also to that point, we didn't have time. I don't know if we'll have time to touch it here, but John McMahon, who is really well known for counter movement jump testing within, I think it's like Rugby Super League. He's really looked into this concept of jump momentum, which is, I think, absolutely essential to this process. So for example, I'll just very quickly state, if you've got a lighter athlete, they need to jump higher. That is what it is, right? And I think potentially that may stem to your linear decel work as well, going back to some of the Philip Graham-Smith work that Brandon had mentioned. If you have an athlete that is going into a task with more momentum, i.e. they're faster or they are heavier, right? Then potentially one idea that I've been kind of playing with is maybe they need a little bit more braking distance relative to what Philip Graham-Smith's model showed, versus the athlete that has less momentum, i.e. they're not as fast or they're lighter. Maybe they need a little bit less braking distance, and they need to be able to accelerate a little bit longer if we're looking at maybe a decent definition of braking capacity, or braking ability, I should say.
Awesome. Yeah, we're going to have you guys on another time, so we'll get all this information out there eventually. So if anyone has questions for you guys, where can they reach you? Where can they find you?
Yeah, so definitely reach out on, I've got Twitter. God, I don't even know what my name is. Is that bad?
We'll link it in the show notes.
All right, we'll put it in there. So definitely reach out Twitter, Instagram, or my email, which is my name, madisonfranek@gmail.com.
Perfect.
Yeah, and I'm not super active on Instagram, but on Twitter, I'm Surber ATPT. So during football season, I'm pretty non-existent, but I usually get back on there a little bit more after. Or you can feel free to reach out to me via email. So it's just BrandonC.Surber@gmail.com.
All right, I appreciate it. So yeah, I'll get all that information, put it in the show notes. So again, thank you guys for coming on. I definitely learned a lot, and looking forward to chatting with you guys again on this topic.
Thanks, James.
Thanks for listening to the Athletes First Performance Podcast. If you have any questions regarding this episode or future episodes, please be sure to reach out on social media or our website. Both links can be found in the show notes.